Welcome to a class that pretty much is going to cover the introduction to epidemiology. As you can see, the screen out there, and we're going to talk about the foundations of epidemiology. And the next thing is we're going to look at the what is health with respect to the what exactly is going on today out there with respect to the pandemic that is going on. And as you can see, the banner itself is pretty much looking at the foundations of the epidemiology. But we're not going to dive in today with respect to looking at the COVID-19, how this pandemic is affecting the entire world, all the seven continents around the world. So the next thing here that exactly we're going to looking at is the what is first the absence of illness, and then from there we will look at the six dimensions of health, and then the next thing is what are those the six dimensions of health. Is if you look at the far to your left of the screen here, you see there are pretty much six of these dimensions, such as the physical, social, mental, emotional, and spiritual, and environmental. And the physical itself is the ability of the human body to function properly, and in terms of physical fitnesses and activities of the daily living. When you look at the social, this is the ability to have satisfying relationship in terms of the interaction with the social institutions and in societal and more. With respect to the mental now, it's the ability to think clearly and reason objectively and act properly when it comes to interactions with some of those social institutions and individuals within the society. The fourth one is emotional, and this is the ability to cope, adjust, adapt in self-efficacy and self-esteem. And the spiritual is the feeling as an individual, as a part of the greater spectrum of existence and personal beliefs and choices when it comes to the ethics issues, when it comes to believing what wrongs and right and what is good and bad. And the last dimension is environmental now, and has to do with the our surroundings, such as an inhabitants, the occupations, and internal factors such as internal structures, such as genetics, in with respect to a human body. So the question is, what is public health now? And by just a very simple definition, we can define public health as the science and art of promoting health and existing life on the population at the population level. So public health now, and then I'll talk about why are we defining public health, because it's concerned with the threats to the health in the population, as what we have seen with this pandemic, the COVID-19. So we as a people now, as a group of people, are sharing one or more characteristics. This is pretty much across the board, has been known for so many years. So the mission now of public health is to ensure conditions that promote the six dimensions of the health in the population as a whole. So, what is the meaning of the population? The population itself refer to collections of individuals that share one or more observable personal observational characteristics from which data may be collected or evaluated. Here we can say things such as socioeconomics, family marriage and divorce, work and labor force, and geographic factors. So, how does the public health now related to epidemiology itself as the foundations of epidemiology. There are many subfields now of public health. This is including epidemiology itself. I think you have heard about it. The biostatistics and health services. So, because of its central role now in public health, epidemiology now is commonly referred to as the foundation of public health. So, what is epidemiology? So, the epidemiology is the study of the distribution and determinants of health-related states or events in human population, and the application of study to prevent and control health problems. So, the pandemic itself in 2020 and 2021, in the 21st century now, we see that we are studying the distribution of the COVID-19, and then we're looking at the determinants. What exactly the COVID-19 as an infectious disease, which is communicable as the way how it's distributed from one populations to another populations, or from one regions to another regions, from one continent to another continent. And then we're looking at some of these health-related states or events that occur with respect to the gathering. So, and also individuals to be attending maybe weddings or anything that has bringing so many people together, and then we have to find the applications of it. One of the applications I can say that we're using with respect to the prevent and the control the spreading of the COVID-19 virus is wearing face masks, social distance, and pretty much isolated yourself from a large gathering of the populations if you don't need to be there. So we define epidemiology, and if you look at the history back of the epidemiology, the word itself, epidemiology, is based on the Greek words. The epi means it's a prefix meaning on or upon or before, and demos is the root meaning the people, and logos suffix meaning the study. So, in other words, this is how we can define epidemiology. Epidemiology is the study of the what befalls the population. So, the key terms in the definitions of this study is epidemiology involves science method of the scientific investigations. So, the methods that they use, they pretty much rely on a careful observations and the use of valid comparison groups to determine now whether the observed health events differ from what might be expected. The distribution now is the study of the frequency, as just indicated in the beginning of these conversations, and the patterns of a health event in that particular populations. And then we look at another key terms here. The frequency now, it represents the number, and the number in relations to that particular population that is affected. And then the patterns now is the health related states or event of a person. You can look at the person, or you can look at the place in the region where exactly that event is occurred, and look at the time and the characteristics that you can be looking at it as a fall, winter, or spring. The word here, determinants, when we're defining epidemiology, it refers is the search for the causes and the other factors that related with a health states or event. So the health-related states or event, if you look at the disease states, we can look at the things such as influenza, pneumonia that is causing by the COVID-19, and also the mental illness that depends on the stress of the individuals that they are going through. And then there's another terms is the conditions that is associated with the health. Could be physical activities, it could be nutrition, or it could be environmental poisoning, it could be seatbelt use when it comes to individuals who they don't wear seats and when they're driving their vehicles, or it could be the provisions and the use of the health services. So events, can be injury, or those individuals who are drug abuse or suicide. The application of this study to prevent and control health problems, we can look at there are significant numbers of the central roles that is carrying out the in the public health function, and I can just mention some of them right quick here. We can talk about the assessments and monitoring of the health of the community and the population at risk when it comes to identify health problems and a priority. And then these are the things why epidemiology is considered by the many out there public health officials to be the foundations of public health. It could be another thing. The second thing could be the formulation of the public health policy designed to solve and identify local and national health problems and priorities. And then the third thing is to assure all the populations have access to appropriate and the cost-effective care. This is including health promotion and disease and prevention services, and then evaluations of the effectiveness of that care. So I'm going to close this here by just looking at the epidemiologic focus in terms of the clinical focus and an epidemiologic focus. The epidemiology and the scientific methods, when they're looking at epidemiology, uses the scientific methods to describe and to analyze related states or events. What is exactly are these scientific methods? The scientific methods involve using appropriate study designs first and looking at some of the statistical techniques for investigating an observable occurrence or acquiring new knowledge. And one of the things that we have observed for the past 2 years with this COVID-19 pandemic, things that we observe at observable occurrence, and then when we went and acquiring new knowledge, this is the health problem itself. It's a COVID. First, you have to define what is that the health problem is a COVID, and then you have to develop the hypotheses, and then you have to find the statistical testing that can test your data that you go to collect, and then after that, you have to provide the interpretations, and then you have to distribute or disseminating or the disseminations of that information that you have compiled, interpret, and perform some analysis and design your hypothesis and define your problem. So let me stop here, and then the next video is going to be cover things such as study design in epidemiology, and we're going to be looking at the descriptive epidemiology, what exactly it is, and then we're going to define what is an analytic epidemiology, and then the later chapter will focus on describing things that they're dealing with the study design. So I hope this short video will help you to understanding the foundations of the epidemiology 101, what is epidemiology, what is public health, and why epidemiology is the foundations of the public health. So thank you for taking your time for listening to these videos, and I hope it's going to help you pretty much to giving you a clear picture what is exactly its epidemiology.